On 21st May 2021, Government of Uganda through the Ministry of Education and Sports instituted a 12-member commission team headed by the former Education Minister, Honorable Amanya Mushega, to oversee the development of the new macro policy of Uganda's educational system. The commission has concluded a field visit in southwestern Uganda to assess the status of both teacher and medical training institutions and gather recommendations and proposals pivotal in crafting a call to action for an educational renaissance in Uganda.
And we are more interested in what should be done to make education piece and this system better. Don't tell us that everything is okay, full stop. We have been to many parts of Uganda. We started with West Nile as a region, then we went to Karamoja, then we went to Acholi, then we went to Teso. We had earlier done Busoga. Then we did, so the gov't country listened to the teachers, the students, parents, local leaders, religious leaders, all those involved in education. And they gave.
We all want to see our education improved, the quality and relevance improved, and so we hope that our report and the government white paper that will come out of it will lead us to where we want to be, to produce products that will be able to lead to the vision of this country, the transformation from peasantry to modern and prosperous Uganda.
The educational institutions visited include Kabale University, National Teachers College Kabale, Kampala International University Ishaka, Mbarara University of Science and Technology, and Bishop Stuart University. Staff gaps, persistent power blackouts, and low remittances of funds from the consolidated fund which hamper campus operations. For instance, Kabale University has received only 9 billion Uganda shillings towards infrastructure in the last 7 years, despite collecting approximately 18 billion Uganda shillings over the years, which the government is yet to remit.
The recommendations about the research to help us with some more money of research, the issue of grants, the issue of non-tax revenue, we would like to maybe be allowed to use it centrally, locally, to help the students locally, because some of the issues that affect students, we are the ones who know what to do with them. But now when the money goes to the central government, getting it back, it takes a very long time and the students get frustrated. We would like to be helped with the infrastructure. We would like to be helped with the staffing. Would be really with equipment, with the labs, that kind of thing, because we are a science-based university and we need much more of the kind. But as per now, out of the 6,661, 45% at least coming from the Kigezi area. It's a community university and it's more accessible by these people. But as you saw at the regional referral hospital, most of the doctors who are introducing themselves are not necessarily coming from the Kigezi area. So we have a bigger scope of students coming here. Now, the issue of a pause or a halt on staffing, I think it's nationwide in terms of government, but for us we are appealing that as we are teaching students different programs, we need different expertise to be able to teach these ongoing programs. But if they put a general freeze on recruitment, it does affect our programs in terms of having the staffing to be able to move on. So in terms of human resource structure, which was approved by public service, we have filled it at 24%, so we still have a long way to go.
At Mbarara University, the Vice Chancellor Professor Celestine Oboa stated that the medical training school faces inadequate infrastructure to accommodate the high numbers of medical students who trek long distances to their halls of residences.
Our admission for the medicine program is now 80. Yes, 80. Is 80. For those whom we are admitting to be trained as medical doctors, 80 from 43. So that tells you, at best, we only double the number of students we are able to admit. And why is that? It's because of one, facility, two, staffing. You need, as a trainee, you need to be taken hands-on to do some of the procedures. There is no way you can go and read about a procedure You need to see it and you need to do it. UNIT, National Council for Higher Education, is saying, for us to call you a professor or a lecturer, you must attain these things. These are the minimum qualifications they are expecting of you. And at the same time, this man is telling me, but when do I have time even to study and get a PhD if from morning to morning I'm working in the clinic, in the hospital?
So you realize most of the students stay outside the university, and this being a course that requires us to be in the hospital most of the time, we realize that we've actually lost students during the night after they are on call while walking back home.
The university's medical school shares premises with Mbarara Regional Referral Hospital, further exacerbating the situation as the same lecturers who attend to students are the ones who also attend to patients.
Here we have this Regional Referral Hospital. Technically belongs to the Ministry of Health, but in practice is run by the university because all the clinical staff, nearly 90% of the clinical staff are employees of the university. So that's a bit of a challenge that we have been having as a university.
Each year, approximately 200 medical students join Mbarara University, but only 15 human specimens are available for anatomy practical sessions.
We are really not having the best, especially in the biochemistry department, physiology. We use the same lab and most of the facilities are not functioning. We do not have things like fire source, gas is not there. We do not have things like personal protective equipment. We do not have most of the things. So you realize in most of these practicals we don't benefit much. Most of the things are theoretical in the actual sense. On top of the building being so small for the big numbers that we have, so you find around 200 students having to do a practical in a lab that can only accommodate around 20 people.
Investing heavily in ICT, subsidizing both science and ICT equipment, and waiving fees charged on work permits for foreign expatriates to close the staffing gaps.
As a KIU, of course, we have been visited on several occasions by the regulators. We have attempted to acquire most of these equipments, but the cry on our side is the heavy taxes on them.
At NTC Kabale, despite good structures that have been put up by government, teachers under training face a challenge of poor accommodation facilities for the boys and inadequate books in the library.
You can see the structures are looking nice, but we have a great challenge over the accommodation on the side of students and staff. When you reach there, what you see as you enter at the gate is not what you find behind there. Even we have the ICT block. It is well furnished with the computers. The space is enough. We have the digital hub, but we have the challenge of internet. Yes, the resource center is there. You can see it is spacious, but it is not fully furnished because the textbooks, as you are saying, were lacking, because the capitation grant you are talking about is small that the government is giving to the NTCs, because as I talk, a student of NTC receives 1,800 shillings per day, and that is the money that is meant to give all the services in a day.
Crispus Arinetwe, UBC News.